Hi, my name's Stephanie Rutherford, and I'm going to be doing my Language of Anatomy video assignment. This is my daughter Kai, who's going to help me out with pointing out the different anatomical landmarks and regions. So we're going to start with the body regions and terminology. So first, we have the hallux, which is the big toe, axillary, which is the armpit, buccal, which is the cheek, pollex, which is the thumb. You'll get 2 thumbs up. Patellar, which is the kneecap or the anterior portion of the knee. Oral, which is the mouth. I'm showing mouth. Mental, which is the chin. You point out to your chin. Brachial, which is the upper arm. So above the elbow, the upper arm. As you can see, she's got a lovely scar here on her upper arm. An old injury. Antebrachial, which is the forearm or below the elbow. Crural, which is the anterior portion of the lower leg, so the front or like your shin. I'll show you here. Umbilical, which is the belly button, and she's already got her tape on for the regions that we're going to do a little bit later. Femoral is the thigh, also where your femur bone runs. Calcaneal is the heel, back of the foot here. Sural is the posterior lower leg or the calf, right here. Will that tickle? Popliteal, stand up, baby. Turn around. Let's move forward. Popliteal is the back of the knee here, where they can't see it, so just go forward a little bit more. There you go. The back of the knee right here. Olecranon is the elbow. Acromial is the shoulder. And occipital is the posterior inferior portion of the skull or back of the head. Right back here. So just crouch down a little bit, babe. Turn turn back here. Go ahead and sit.
I like snapping.
So now we're going to go over directional terms. So we're going to talk about inferior, superior, and all those different kind of things. So the head is superior or above the sternum, which is our breastbone. No. The olecranon is distal to the acromion. So distal is farther away from the point of origin. So the acromion is the point of the shoulder here. So distal is farther away. The axilla is proximal to the brachium, so it's closer to the point of origin of the midline than is the brachium, which is the upper arm. The nose is medial, which means in the middle to the eyes. The elbow, is proximal to the carpus. Carpus is our wrist here, our wrist joint, and the elbow is proximal, so again close to the midline. The sternum is anterior to the vertebral column, so the vertebral column is in the back or posterior, so the sternum is anterior to that. The umbilicus is inferior to the sternum, so again our umbilicus is our belly button, and it's inferior or below the sternum. The patella is proximal to the tarsus, so the tarsus is our ankle, and the patella, which again is that anterior portion of the knee or the kneecap, is proximal to the tarsus, so it's closer to that midline. We have our ears. Our ears are lateral or to the sides of our nose, which is medial. Okay, good. Can you stand up? So now we're going to go over our 9 body regions. So we did go ahead and divide the abdominal cavity into the 9 regions here. So I'm going to go over what each portion is, as well as what organs can be found in each of those different regions. So I'm going to start in the middle. So first we have the epigastric, and part of the liver and the duodenum are housed there. The umbilical, which is the belly button, is where the transverse colon, which it goes across, is housed, as well as some of the small intestines right through the middle. Now we have hypogastric. Hypo means below, so we're below the stomach, and housed there is the urinary bladder and part of our sigmoid colon. So I'm going to come up on her right side. Now it's her right, not my right when I'm looking at my patient. So on her right side, it's the right hypochondriac region, and housed there is the gallbladder as well as part of the liver. The middle portion here is the right lumbar and part of the ascending colon, which means it's going up, so it's ascending, and some of the small intestine are housed there. The right iliac region is where the cecum as well as my appendix is housed. I'm going to turn this way. So now her left side, so on the left hypochondriac region is part of the stomach as well as the spleen, which lies behind the stomach. Left lumbar is the descending colon, which means coming down, and some of the small intestine are housed there. Now my left iliac region is part of the sigmoid colon as well as some small intestine in that area. So I hope this was clear, and I thank Kaya for helping me and get this submitted. No, you don't need to say anything, baby. Thank you.